Hi, this is Jessica DaMassa with GuideWell. I'm here at Exponential Medicine, and joining me right now is Jason Altmire, GuideWell's Senior Vice President for Public Policy and Community Engagement. So Jason, thanks for catching up with us today.
Glad to be here.
Thank you. Just want to get your thoughts on what you've seen so far here, some of the speakers at XMed, what's been high on the impact list in terms of the points that have been made for you.
What's amazing about this is you have a lot of big thinkers in the same room, a lot of people who are working on groundbreaking research and development of new medical technologies, and it's really exciting to think about what the future holds and how the world is going to adjust to those. There's going to be unintended consequences to a lot of these things that people are talking about. So on one hand, you have a lot of excitement, a lot of big ideas. On the other hand, there are things that we're going to need to think about moving forward on how to promote those ideas.
What in particular? What are some of these unintended consequences that you're concerned about?
Well, we had a presentation on genomics and,
Okay.
and artificial intelligence and all of these things that sound exciting. They sound like science fiction, 3D printing. These are things that are really going to happen in medicine. We're getting very close. But when you think about what the impact is going to be and what the morality of some of these issues with selection, prenatal selection and things like that,
Right.
of character traits, those are some of the things that they're talking about. I think people are going to get uneasy when they hear about the details of that.
Do you think that the innovation industry, especially in healthcare, do they need to be a little bit more mindful about public policy, or do you feel that there's a good balance going on there right now?
Public policy is a big part of this conference. Almost every speaker who's talked about a new medical device has been somewhat critical of the FDA and the approval process, and it is true we have one of the slower approval processes in the developed world, but there's a reason for that, and I think striking the balance between patient safety and not moving too fast on things that are still in the development stage, but also giving free rein to patients and folks who are willing to pour money into that type of research, angel investors, to be able to do so. But you want to make sure they're making wise decisions and spending money in a way that's socially appropriate. So I think that's the push and pull of the discussion we're having today.
Excellent. So, last thoughts. What are you going to take back with you, back to GuideWell?
There's a lot of big ideas. There's a lot of things that the American public are going to be interested to hear. But again, it's going to be all about making sure that when you're funding these types of initiatives, you're funding things that are going to be important for the future, and you're doing it in a way that makes sense from a moral and economic standpoint.
Excellent. A lot to think about there. So thank you so much, Jason, for talking with us. We hope to catch up with you later.
Thank you. Glad
Thanks
to
so
do it.
much.